Good evening. On the occasion of International Women's Day, I welcome you all to this very significant and timely discussion on breast cancer, an initiative by Roche supported by Integrated Health and Wellbeing Council. I'm Riddhi Lakra, Assistant Editor, IHW.TV. Breast cancer accounts for the most common malignancy amongst women globally. In India, it is the most common form of cancer in women. Over 1 lakh new breast cancer patients are estimated to be diagnosed annually in India. It is reported that every 4 minutes, an Indian woman is diagnosed with breast cancer. When we talk about the survival rate of the patient with breast cancer in India, it is poor as compared to the Western countries due to the early age at onset, late stage of the disease at presentation, delayed initiation of definitive management, and inadequate fragmented treatment. The reasons for a low breast cancer survival of women in India include the lack of awareness, poor early screening and diagnosis rates, apart from the economic cost of the medical interventions. Today's discussion will be focused on creating awareness. So to talk about breast cancer and its various critical aspects, we have with us Dr. Kakoli Lahkar. Dr. Lahkar is a consultant medical oncology at Manipal Hospital's Old Airport Road, Bengaluru. With the 10 years of experience in the field of medical oncology, she specializes in chemotherapy for solid tumors like breast, ovarian, gastrointestinal, and head and neck cancers. Dr. Kakoli, we welcome you for this discussion.
Hello, good evening to everyone. So I am Dr. Kakoli and I am here to help you understand breast cancer better.
Doctor, firstly, we would like to start with a very important question. When we come across, a lot of people talk about the symptoms. So if you could tell, what are the various symptoms of breast cancer?
Common misconception is that breast cancer is associated with pain. So pain is generally a very, very rare symptom of breast cancer. Most of the times, breast cancer presents as a lump in the breast. See, not all lumps are breast cancers, but any lump which is hard and which is dominant throughout the menstrual cycle should be evaluated. Other than that, there can be changes in the skin of the breast, like there can be redness, there can be thickening, dimpling, puckering, plus there can be changes in the nipple areolar region, there can be retraction of the nipple, there can be ulceration around the nipple, and there can be discharge from the nipple, especially bloody discharge is a red flag sign. Besides this, some women can also present with swelling in the armpit, which is known as the axilla, and also on the neck region. So this generally denotes advanced breast cancer. So these are the common signs and symptoms of breast cancer in women.
Thank you so much, doctor, for the various inputs what you have shared. I hope a lot of listeners who are seeing this and listening to this will understand the various symptoms of breast cancer. Coming to my next question, when we talk about the risk factors, one of the risk factors is the reproductive health and the menstrual history of the patient. So does reproductive and menstrual history increase breast cancer risk?
How much it contributes actually to the causation of breast cancer is not very clear, but there is some increased risk associated with early menarche at less than 12 years. Nowadays, we see a lot of girls get their first menstruation below 12, even at 10 years, 11 years. That is what my colleagues tell me, my gynecology colleagues tell me. Also, late menopause at more than 55 years. Then these factors can increase the risk of breast cancer. Then having coming to reproductive history, having the first child after the age of 35. Actually, it used to be 30 before. Now, because most women, generally, do not have their first child. Most women get married, especially in the urban. So breast cancer is an urban disease, especially in the urban areas. Women get married late, they have children late. So 30, 35, more than 35 significantly increases the risk. More than 30 also there is slightly increased risk. And not having children, which we call as nulliparity, that increases the risk, and lack of breastfeeding. So that is something very important. Breast cancer at the end of the day is a hormone-related disease. So most of the breast cancers are actually dependent on the hormones, on the female hormones, estrogen. So that is the reason it is more common in females. That is the reason, we see that breast cancer in females, because it is a hormonal disease. These factors, the menstrual and reproductive cycle, are directly associated with the female hormones. So that is why the more the exposure of the breast tissue to hormones, So when you breastfeed, so people might ask, what is the relation? So when you breastfeed, for a long period of time, there's something called lactational amenorrhea. You do not get periods during the breastfeeding, the breastfeeding period. Most women do not have that period. So the reduced number of cycles, of menstrual cycles. So pregnancy also. So if you're pregnant, then you do not get menstrual cycles. Those are breasts do not get exposed to estrogen. So that is basically the scientific basis.
Thank you so much, Doctor, for explaining that. Dr. Lahkar, coming to my next question, when we talk about, a lot of people do not understand about the pains. When we talk about the symptoms, a lot of people do not understand about the pains. There are pains in their body, but it is very difficult to differentiate between them. So do all the pains in the breast lead to breast cancer?
That is a very, very common misconception. And even in my clinic, a lot of women come because they have pain in the breast. So pain in the breast, or mastalgia, which we call it scientifically, a medical term is mastalgia. So that's very common, before the periods. That's mostly related to hormonal changes in the breast tissue. Throughout during the menstrual cycle, different changes which happen. Most of the time, see, breast cancer it presents as a silent lump. It presents as a silent mass in the breast. So pain is very, very rarely associated with a special type of breast cancer, which is called as inflammatory breast cancer. So that occurs in about 5% of women. That constitutes about 5% of all breast cancers. So it is very rare. In the advanced stages, in the very, very advanced stages, if somebody has ignored the lump in the breast and it becomes ulcerated and it fungates out, so then of course there will be pain. But most of the times in the early stages, there is no pain.
Thank you so much, Dr. Lahkar, for explaining that. When we see, like in India, we see a lot of breast cancer as one of the common cancers, what we see in the women. So how common is breast cancer in our country? Is it compared to the Western countries, is it more?
So that's what I have alluded to that point. So it is the commonest cancer in India, both men and women combined. So there was a time when cervical cancer was most common among women in India. Worldwide, actually, it is lung cancer which is common. It's the commonest cancer both among men and women. If you take the combined statistics, the lung cancer is the commonest, and breast cancer is the commonest cancer in women worldwide. That's the global statistics. In India, as per the Globocon data, the latest Globocon data, 2020 data, breast cancer constitutes 13.5%. That is the exact percentage, 13.5% of all cancers in both men and women. So obviously it is the most common cancer in women, but it is also the most common cancer overall in the population. And like I said, around the incidence, when we say the number per 1 lakh population per year, so that is around somewhere between 35 to 40 women. And actually 1 in 8 women have a lifetime risk of developing breast cancer. So that is how appalling the numbers are.
We already spoke about the various risk factors earlier, but if you could tell us who exactly can get a breast cancer?
Actually, when you ask, generically speaking, anyone can get. Adult men or adult women can actually get a breast cancer. Men and women, like I said, 1:100 is the ratio. For every 100 women, 1 man can get breast cancer. So I will just clarify that part a bit, because there is a common misconception that men never get. They do not have breast. They do have breast tissue. They do have some amount of rudimentary breast tissue, so they can get breast cancer if they have genes, if they carry genes which predispose to breast cancer, or if there are some hormonal imbalances. There are some hormonal syndromes in men which can predispose them to breast cancer. So leaving that aside, mostly it is a cancer of women. So first of all, if I start from the biological perspective, like I already said, age, it is more common, in the 6th and 7th decades. However, any adult woman, we have seen breast cancers in early 20s. So any woman can get breast cancer. Again, like I already alluded to about the menstrual history, early menarche, late menopause, nulliparity, that is not having children, having the first child beyond 30 or 35 years of age, lack of breastfeeding, radiation exposure to the chest, especially in childhood, use of hormone replacement therapy, obesity, that is overweight or being overweight or obesity, lack of physical exercise, diet consisting of high saturated fat, alcohol consumption. So these are some of the risk factors besides some benign breast diseases, architecture or texture of the breast, dense breasts, patients who have, people who have, women who have certain benign breast conditions, something called atypical hyperplasia. So these can predispose to breast cancer. Again, 5 to 10% hereditary. And now when I say hereditary, I would like to clarify a few points here, because it's not like supposing a woman's mother is diagnosed with breast cancer, say at 65 years or 70 years, that doesn't automatically, make it hereditary cancer. So there are some features of hereditary cancer. So this is a very common, kind of question which people have on their minds. So I will just clarify some points. So when we say hereditary, there are some specific characteristics, like, if you have 2 or more first degree relatives. First degree means parents, siblings. So first degree relatives and their grandparents. So first degree relatives, if you have 2 or more on the same side of the pedigree, who have had breast or related cancers or multiple cancers, in the same individual in the family. Like supposing someone's mother has both breast and ovarian cancer. So it's likely to be caused by a hereditary predisposition. Features like bilateral breast cancer, that is breast cancer if a woman presents with cancer on both breasts, say, or with multiple cancers in the breast, ovary. So then there are certain types, there are certain pathological or medical features, like when we do the biopsy, there are some things we see on the biopsy, something called triple negative. So that is a specific type. So that is known to occur more in, kind of your hereditary breast cancer. Then unusual presentation, like a male having breast cancer, say. So that is also, more likely to point towards the hereditary origin. Then there is some ethnicity is involved. Ashkenazi Jews are known to carry, frequently carry a mutation called the BRCA1 or 2. These are the most common genes which predispose to breast cancer. So these are some of the features of breast cancer, and or age less than 45. So 45 is the cutoff, younger age of presentation. So these are some of the features which may indicate that it might be hereditary, and there are genetic tests available. There is a simple blood test. Now we have in India for a few thousand rupees, just by a blood test, we can actually tell if it is hereditary or not.
Doctor, coming to my next question, it's a very important thing about self-breast examination. And a lot of experts have already spoken about that. It is a very important thing in breast cancer screening. So, doctor, how often should one go for a self-breast examination, and how it can be performed?
The breast self-examination should be done ideally monthly, every month, and the timing is very important. So, the breast self-examination should ideally be done between the 5th and 7th day from the onset of periods. Like if you do it just before you get your periods, then the texture of the breast changes. It's very difficult to pick up a lump, and the breast might feel lumpy in general. So it should be done 5 days or 7 days after the start of between 5 to 7 days from the start of the periods. And you should look for a dominant lump. So you feel something this month and you feel the same thing at the same place the next month, that is very, very suspicious. And usually something which slips from your fingers is generally not cancer. So generally cancer, the masses will be hard and they will be fixed, and they will most likely be at the same place. And most of the times, almost 99.9% of the times, they are painless to begin with. So these are the features.
Okay. Doctor, when we talk about the screening, when exactly the woman should go for the screening of the breast cancer? Is it in the early stages? Because in India, we do not have such options. When compared to the Western countries, we do not have mammography so easily available for our Indian patients. So when do you think the woman should go for the breast examination?
As per the international guidelines, American Cancer Society guidelines, and there are other societies also, most of them agree that any woman over the, this is for the general risk population who do not have a high risk because of heredity and other things. For the general population, every woman should start yearly mammogram from the age of 40 every year. And younger women who may want to still, because like I said, there's no hard and fast rule that it occurs only after a certain age. Younger women can go for an ultrasound. So mammogram we generally do not recommend below the age of 40 because it may not able to the architecture of the breast is such that the mammogram may not be able to pick up the breast cancer in younger women. And plus, there is some amount of radiation exposure in mammogram. It's very minimal, but we do not want to expose younger women to that. So, in younger women, self-examination is always encouraged for everybody monthly. But if they want to do a test, they can go for an ultrasound of the breast. They can start an ultrasound starting at 25 years of age. There is absolutely no harm in doing an ultrasound once a year. But the recommendation is from 40 years for the general population. And if there is a known predisposition, there is a known genetic mutation, and women who have a lifetime risk of more than 20%, more than or equal to 20%, that is based on different models. Okay, based on some benign breast diseases, heredity, lots of things are there. There's a scoring system. So they can come to an oncologist, they can get the scoring done. And if the lifetime risk is more than equal to 20%, they can go for an MRI of the breast. So MRI of the breast starting at the age of 25 or 30, they can do an MRI alternately with a mammogram. Like every 6 months, once MRI, once mammogram.
Doctor, earlier we were talking about the mammography. So is mammography very painful process, or how is the process done? If you could explain that.
Mammogram, it's a digital X-ray basically, and there is some amount of compression of the breast, to get the exact architecture and the exact picture of the architecture of the breast. There is some amount of compression, so it is somewhat painful. So generally, we do not do it immediately before the periods. Like I said, same thing with the self-examination. We generally time it, a week from the onset of periods. So, and sometimes some women are sensitive, then we can always give them, pain medication, but most of the time it is not necessary. There is some amount of pain, but it is not very significant. I would also like to say that because I didn't mention it in your earlier question, that mammogram actually reduces the risk of dying from breast cancer by 25%. So that is a huge number. Just one test after the age of 40 and the mortality goes down 25%. So, we should try to reverse the statistics, read the statistics as we are progressing economically as a country and as we are progressing in every other way. This is also something, we should keep in mind. We should, at least in the urban areas, at least corporates, everybody, anyone can encourage, NGOs, corporates, educational institutions. It's just a matter of awareness. It's not a very costly investigation. It is available, at least in the cities, it is available in most of the hospitals and most of the, laboratories or clinics or radiology clinics. So it's a very simple test. And this is the difference. The difference it can make is enormous.
Doctor, we often talk about the thing that cancer is caused by alcohol. Cancer can be caused by the lifestyle we have. And some of the major factors is from the environment as well. So how can one lower their risk of cancer, breast cancer especially?
Right. So like I said, breast cancer, I cannot call it a preventable disease because we do not exactly have a vaccine. There isn't a pill which you can just pop and breast cancer will not happen. So it's basically what we can do is lifestyle modification. We can have a healthy diet which is rich in fruits and vegetables, and that applies to all diseases. That applies to your heart attacks, that applies to diabetes, hypertension, all other cancer, most of the cancers also. Healthy diet which is rich in fruits and vegetables, low in saturated fat, regular physical exercise. When I say regular physical exercise, it generally constitutes 20 minutes of brisk walking every day. That is enough. Okay, I'm making it very simple. I mean, you do not really have to go to the gym, work out for hours together. You do not have to go on a crash diet or anything like that. It's always the key to a healthy life is moderation. So 20 minutes of brisk walking is enough. So that much of physical activity, because most women who work in urban areas, most of the time they have jobs which require them to work in offices. They do not get the kind of exercise which is necessary to maintain a healthy body weight or to maintain a healthy healthy physique. So 20 minutes of brisk walking. Hormone replacement therapy for postmenopausal women, be very, very careful. If you are just having some minor symptoms, those things, most of the hot flushes and things like that, vaginal dryness, there are other ways to tackle them. There are other medications. You do not have to go for a hormone replacement therapy. If there is a bone loss, we have very good agents nowadays to increase the bone health. So, the use of hormone replacement therapy should be very, very judicious in postmenopausal women. That is one thing which we can do. And if there is a hereditary risk, if you know or if you suspect, of course, then you have to do the screening as advised with MRIs and all that. And if you suspect, like I said, multiple members in the family having cancer, or a male person in the family who, an uncle or somebody who has had breast cancer. So that's something very rare. So if there is a suspicion, the genetic test is very, very simple. Like I said, it's just a blood test and it costs a few thousand rupees. So it's very, very simple. It can be done. And if you know that you have a breast cancer, there is something called risk reduction surgery. So something which Angelina Jolie is famous for. She actually got her breast and ovaries removed and reconstructed, of course, but because she carries that gene. She carries the BRCA gene, which I alluded to before. So if a woman has completed her family, or she feels she wants to undergo risk reduction surgery, then there are options available for that in hereditary breast cancer. Then breastfeeding is essential. If there is no issue with lactation as such, then I would encourage every woman to breastfeed their children. So these are some of the things which one can do. And of course, alcohol. So, I do not believe in, kind of going and, kind of admonishing people or telling people that do not. I'll just say that moderate consumption. I mean, if somebody is consuming, I'm not saying that it is up to the individual. But if possible, avoid alcohol or at least limit the consumption of alcohol. So that's something which people can do. So these are some of the things which we can do, which can reduce the risk of breast cancer to some extent.
Doctor, when we talk about the healthy diet, a lot of people say that, and experts have also said that eating a healthy diet can prevent breast cancer. So is it true that eating a healthy diet will help prevent breast cancer?
I've already said nothing. I mean, there's no way to completely prevent it, but healthy diet can reduce the risk of a lot of diseases, including breast cancer. Whether it is heart diseases or diabetes or high blood pressure, colon cancer, prostate cancer, in a lot of things. I mean, a lot of things are associated with an unhealthy diet, with too much of carbohydrates, refined sugar. Refined sugar is supposedly the biggest villain now, even more than fat. Saturated fat, these are known to increase the risk. And of course, when we say diet, alcohol is scientifically included in that. So that I have already alluded to. So quit smoking. Smoking, I'll be very, very strict that, you should quit smoking, because it not only harms you, it also harms the person who is in front of you. So alcohol, avoid it if possible. Otherwise, limit the consumption. Limit the consumption of alcohol. So these are some of the things which can reduce the risk. I wouldn't use the word prevention. I can use the word prevention for cervix cancer, because you have a vaccine for that, and we have other ways to treat it early. But in breast cancer, I would use the term risk reduction, not prevention.
If you could tell our viewers, what are the treatment options available for breast cancer? And can this be availed at a normal hospitals as well?
Generally, breast cancer is a highly curable disease and highly treatable disease at the same time. When it is curable, that is, there are 4 stages of breast cancer up to stage 3. And in these stages also there are subdivisions like A, B, C and all that. But up to stage 3, we consider it curable. The percentages may vary. Like in stage 1 and 2, it is more than 90%. In stage 3, depending on A, B, C, it can vary between 40% to 60%, 70%. But nonetheless, it is curable still. So when it is curable, it generally involves a combination of surgery, chemotherapy, radiation therapy, radiotherapy. Surgery can be both removal of the entire breast, and most of the cases nowadays we do breast conservation. That is, we conserve the breast and we just remove the cancer as part of the breast. So that is possible nowadays. Most of the times that is what we offer, as if it is possible, if it is not like significantly advanced, when we have to remove the whole breast. So as far as the chemotherapy is concerned, here I would like to add one thing, that breast cancer is no longer a homogeneous disease. So it is a very, very heterogeneous. So it is not, the treatment also is not one size fits all. It is bespoke tailoring of treatment, to be precise. So it really depends on the type. So based on the molecular testing and on the pathological features, the histological features, it is divided into a few types, usually 4 types. And depending on what is positive, we choose a treatment option. The surgery and radiotherapy is different. So that is, that depends on the size and, of the extent of involvement. But the other systemic therapy, with the chemotherapy, whether we use targeted therapy, whether we use immunotherapy, whether we use hormonal therapy, whether we can avoid chemotherapy completely in some cases, even that is possible nowadays. We have to do some molecular testing in elderly women, especially in postmenopausal elderly women in early breast cancer. We might be able to avoid chemotherapy altogether. We can just get away with hormonal therapy. And nowadays we routinely test, in most of the breast cancers, we routinely test for the germline mutation or the genetic mutation. And if that is positive, again, tablets are actually available to reduce the risk of recurrence. So it really depends on the type of the cancer, the stage of the cancer, the individual, it's the overall, the whole picture, the age of the individual, the health condition. Depending on that, the permutation and combination will be different. But we choose from an entire gamut of medicines. Like chemotherapy, of course, it was there, it is still there. But along with that, we have targeted therapy, something called HER2 targeted therapy. That has also become very, very sophisticated now. The testing for HER2, newer therapies are coming up every day. Then hormonal therapy, if the disease is hormone positive, estrogen receptor positive, then we use hormonal therapy along with the other things. And in certain cases, even in early cases, we use immunotherapy. And when I come to the late stage or stage 4, in that case, it is not curable, but still we can get a very long survival nowadays with the use of these agents, combination of chemotherapy, hormonal therapy, targeted therapy, and immunotherapy. So immunotherapy has also come in a big way that has changed the entire picture, the entire prognosis of breast cancer. Adds to both the quantity and quality. We still cannot cure people in stage 4 or last stages, but they can get a significant survival. I have patients living beyond 5 years with metastatic breast cancer with these agents.
I hope there are a lot of therapies, and as you have spoken about the immunotherapy, I think these things will help in the future, that people would not be scared about the treatment, and they will actually go and get them screened and go for the treatment easily. Doctor, when we talk about chemotherapy, we see a lot of women are scared of that. We have already seen in movies, we have seen in a lot of shows that after a chemotherapy, the person loses hair. So if you could explain to our viewers, what are the major side effects of chemotherapy and how that can be overcome?
Generally, we divide them into, the ones which are not permanent, which are, temporary, like hair loss, which we call as alopecia, some amount of nausea. See, nowadays, vomiting is, there's more hype around vomiting. It used to be a big problem before, like a decade back or 2 decades back. Nowadays, we have very good anti-vomiting drugs. So most of my patients, they do not have vomiting as such, but they do have some amount of, decreased appetite, loss of taste, altered taste sensation. So these are the temporary things. Loose motion. Some of them can get loose motion. Some of them can get some mouth ulcers. fatigue or tiredness. These are the temporary side effects which can be easily dealt with. Among the major side effects, the immunity decrease, the blood counts being suppressed, because chemotherapy tends to suppress the blood counts. Blood counts as in the white blood cells, the hemoglobin, the platelet count. So if the white blood cells go down, the immunity goes down, patient becomes more susceptible to infections. Simple infection can become severe. So even though we have injections to prevent that from happening, but still some people do get that. So myelosuppression is what we call that. So these are some of the immediate or the short-term side effects. On a permanent basis, infertility is something. So most of the times breast cancer occurs in women who are, even though they're not very elderly, at least most of them are beyond 35-40 years of age. So by that time, most of them would have completed their families. So it is not a very major issue, but still in some women it can be an issue. Infertility that can be permanent. Early menopause, early induction of menopause because of chemotherapy. And there are some agents, 1 or 2 drugs that can have some long-term effect on the heart. So these are some of the common side effects.
Thank you everyone for joining us today. And I would like to thank Dr. Kakoli on behalf of IHW Council and Roche for taking this initiative to talk about this very important disease, that's breast cancer. And on International Women's Day, I hope a lot of women who listen to this session can understand how simple is the breast cancer treatment, and one should not be scared about this. Thank you everyone. Have a good day.